welcome to the African Emergency Room. Remember, we are your health education partners, especially with matters that concern our faith and our religion that affect our health. We want to look at all those myths, all those beliefs that are always affecting us and make us doubt medical science, or even make medical science doubt some of the things that work in our tradition. So here in the African Emergency Room, we try to bring them out, we marry them together. We want to welcome you to this show today and to congratulate Africa, Nigeria, and all of you who have survived COVID-19 so far. Those who have had it and recovered, those who have been able to run away from it by observing all the protocols they need to observe. Thank you, everybody. Welcome to today's show. Today we have a special guest in our midst, and today we're doing African ER special. Not your regular kind of African ER show. This one is special because we are looking at a particular group of doctors, the Association of Resident Doctors of the Federal Capital Territory Administration. We're looking at them today and what we would like to call the other side of ARD FCTA. As you follow us on this show, I would want to introduce to you our special guest today on the show. He's the president of the Association of Resident Doctors of the Federal Capital Territory Administration and also a senior registrar with the Department of Ophthalmology in the Asokoro District Hospital. He is no other person but Dr. Nnamdi ND-Ezuma.
Thank you very much for having me. It's a pleasure being here. I've always wanted to be in African ER, so I'm so happy to be here today. Thank you very much.
Thank you. And the Africa ER, we always wanted to have you. And we heard about the wonderful things the ARDFCTA has been doing, and we've been looking for ways to talk to you to find out why you're doing all these things. Yeah, but there's this particular thing people know about ARD in Nigeria generally, National Association of Resident Doctors, and the resident doctors in the FCTA. People say that they go on strike a lot. So before we look at the other side of ARD, let's talk about this side that people know a lot. Going on strike. Why do you go on strike?
Well, that's an interesting question. There's no doubt that when people talk about Association of Resident Doctors, the first thing that comes to the mind is strike actions. Some will say they are the radical arm of the medical profession. They are where you have the foot soldiers, you have the major workforce of the health system. And unfortunately, we find ourselves in a system where you need to drag or you need to fight to get what you want. Sometimes we find ourselves in situations where the only language our employers or the government usually listen to is when we decide to take drastic action. But be that as it may, strike is never the first option. It's always the last option. So even if they end up going on strike, it will be that all other options have been exhausted and there were no other ways to sit at a round table to discuss the issues on ground. But most importantly, the reasons for the strike still boils down to the health system, the welfare of those in the health system and those who the health system are providing the care for. So that's basically it.
Thank you very much, Mr. President. Yes, viewers, we like to look at the other side of the resident doctors of FCTA, different from what you know as them going on strike a lot. And the president here has told us about fighting for the welfare of the doctors and by extension, the welfare of the people the doctors cater for. It is on that note that we saw some things that ARDFCTA has done for the people, and we want to find out what motivated that and how often do they do that. Is it like constitutional for them? Is it what they like to do? So I followed what has been going on with ARDFCTA, and 2 years ago, 2019, December, I think, there was the Health Week of the Association of Resident Doctors of FCTA. And then they went to a health center in Jai, somewhere in Jai in the FCT, and renovated a toilet facility there. There are a lot of women who go to that health center with their pregnancies, for antenatal care and all that. And there were these toilet facilities there that were terrible, that women would prefer to do the thing outside than going into those facilities. and I saw that they renovated it. And I was wondering, does the community know this side of the resident doctors? And Mr. President, please, why do you do things like this?
All right, thank you very much for that question and the opportunity to even address this kind of issues. Over time, we've seen that we have not been very effective in trying to let the public know that there's still another side to the doctors. And I mean, even in the clinic, in the hospital setting, we actually understand firsthand what people go through in terms of managing some of these conditions or illnesses they come with. Some of them are also associated with the kind of places they are coming from. So as an association, I mean, as a group or as a profession, I think we are even in a position to understand where these people come from and how they feel. So as an association, we have what we call our annual general meetings, which it takes place once in a year, usually at the end of the year, but it goes through the whole week. It takes the whole week for it to go through. So we try to organize events that give back to the society what we feel are the issues or trending issues at that point in time. So just to go back a bit, 2019 wasn't the first time we actually went to Jahi. We were there in 2018. And in 2018, we noticed that there was a primary health center in the center of town where people still seek health from, and it wasn't in a good shape. We noticed that there were no doctors on ground. They were just maybe healthcare providers that were just, averagely trained. And we actually tried to reach out to the management to see how we could, how we could accommodate them and have our members to go once in a while to see patients and ill people in the hospital, in the primary health center.
For free or for
free?
For free.
No, there was no fee attached to it. So what we did in 2018 was more like an outreach. So in 2018, we went there. We did an outreach where we did free testing. We collaborated with some NGOs. We did free lab testing, HIV, sugar testing. We saw patients. We did antenatal clinics. We did eye examinations. We gave free drugs. We gave health talks. We did dental examinations. So we did a lot of things there. So that was in 2018. And we felt, okay, it shouldn't be that we'll just come and never come back again. So in 2019, we decided, okay, now they have known us as part of them. We decided to work on the structures that were there. We noticed that their waste disposal systems were not properly catered for, were not well kept. And so we decided to invest, sought for sponsorship, and also from our own personal association's pockets, and we decided to fix up the place. And I mean, the local government chairman, the area council representatives were all there. It was actually a very interesting outing, and I think bringing smiles to people in the little way we can was what did it for us.
Wow.
We were happy about that, and we did not stop there. But I mean,
Yes.
we're going to continue.
Yes, you didn't stop there, because I'm coming to the big one. But I didn't know you did all that for Jai even before 2019. But that's wonderful. And so many NGOs out there, I think you can learn from the FCTA. This is how to carry out an outreach. You go do something that helps you to know what the people really need, the kind of illnesses that are common there, the major problems there. Then you go and advocate and come back to solve the problem. You don't just go give people malaria drugs and BP drugs and go away. They finish it for that period and their problems are not solved. True. I think we should be learning from the experts here. That was wonderful. But that brings me to, but before we go to this major one, let's go for this quick break. We'll be right back. Welcome back to the African Emergency Room. Before we went on that break, we were talking with Dr. Nnamdi ND-Ezuma, the President of the Association of Resident Doctors of FCTA and the Senior Registrar with the Department of Ophthalmology at Sokoro District Hospital. He was telling us about the other side of ARD FCTA. Presido, yes. Last year, in December last year, you guys took something wonderful to a community in Kwali Area Council. Can you take us through that project?
Yes. Last year, just as I said, every year we try to organize a health week, where one of the highlights of the health week is how we can give back. Give back to the community, especially those who cannot find their way to the hospitals, especially for some of those that are in the specialist part of the profession. We noticed that, first of all, we know that the ARD FCTA covers the 14 district hospitals. So we noticed that in one of our areas, that is the Kwali and the Gwagwalada axis, in the hospitals there, we were having frequent cases of patients coming in with bloody stool, bloody urine, abdominal pains, and one or two thinking and research work was done to find out that it might be their exposure to the kind of water they were actually getting. So we decided to scout around, especially in that area, Kwali Area Council, to see if we could find out where we had a good number of people that were located and what were their mode of use of water disposal and waste disposal and all that. So we now found out that there was a community, Ebu community in Yebu ward. Yes, so it was found out that they had to always go to a stream to get water, and in fact their major light source, and this community, I must say, was quite a distance from civilization. There were no roads, no networks, you can't even make calls there. The road access, going there, it would be as if someone is taking you to So but it was interesting to see that people live here, and a lot of them have families. They come into town, perform their activities, and go back. And most times, those we see from the hospital were coming from this axis. So, found out that they didn't really have any source of water, And so, what better way to give back than to provide? In one way, you sort out their own personal issues, and the other way, you also sort out their health issues. You reduce the cases that come to the hospital, you reduce the mortality, and at the same time, you provide good water and good access for them.
And like they say, in sub-Saharan Africa, we have this problem of water. Of course, we know there's water everywhere. There's water in the rivers, in the oceans, but there is hardly water for the common man to drink and to use. And a lot of our illnesses and diseases in sub-Saharan Africa are tied to water.
True.
So by providing water for the people of Igbo community, you have solved beyond schistosomiasis. Because I can imagine that if there's cholera outbreak in that river, something in that river, everybody in the community gets it and they go home to drink it. And we see some cholera here and there these days.
True.
And I don't know, we can't reward you, we can't thank you enough. The whole of the network of the Association of Resident Doctors of FCTA across the 14 hospitals, the district and general hospitals of the FCT. This is so wonderful, and I'm just hoping that since you said you do this annually.
Yes, it's
so we're expecting something big for 2021.
The idea is, we know that the world is a global village, first of all, and we need to show, it's always that, just as the program started and the first impression was, Association of Resident Doctors, am I here to talk about strike action and all that? But the truth is that, as I said, we are even in a position to know firsthand what these patients actually go through. Yeah. And I think we are also in a position to see what we as individuals can do, especially for those that don't have access. So it's a yearly thing. It has come to stay. We would always make sure that during our health week, We try, and even outside our health weeks, we have what we call the medical outreach committees that go out, oral health days, child pediatric days, ophthalmology days, glaucoma days. So we try to go back to schools, to churches, to religious houses, mosques and all that, to see where we can render services, especially for those who do not have access.
Okay, so there's a big one that comes once in a year, but there are other things you keep doing throughout.
Like this year, we've done our oral health day. So we had visited, although in collaboration with some of the NGOs, we had visited schools. We had given out toothbrushes, toothpaste, giving talks on oral health. We also had a glaucoma week. In glaucoma week, we hosted, all the staff.
Your area.
Yeah, that's my area, actually. So we did an eye check, a screening. We do that in the hospital, and we even do it outside the hospital service. So it's something that, as long as we are able to, I think even in our oath, we try to also uphold it, to try to see what we can give back and do for the community.
Yeah, thank you for bringing the oath fact, because that's whenever we hear resident doctors on strike, that's what the masses try to. I don't know how many of the people have seen this oath, but that's what everybody they took oath. This is what they took oath to do, to help the community. Now, the Association of Resident Doctors is not government, okay, but they can advise government, because like the president here is saying, they see firsthand the problems of the people, the health challenges of these people, and how it can even affect socio-economic situations of the whole community. And this is what they get to do. I heard about the Jai toilet project, the water project in Kwali. I said, oh, please, we want to hear it firsthand, and we want the people to know. So my last question for you is, does any community have to lobby to be considered for the next project?
No, just like I said, for the Jahi community, it came up because we felt that we had, the district hospitals had areas where they cover. And we noticed that there was a kind of a lacuna around that axis. And we didn't really have where the patients actually go to. I know some of them actually head to Gwarimpa, but at the same time, we just felt, okay, we had not come here before, we had not seen and we had a lot of patients coming from that axis, so we decided to go in there and investigate for ourselves. For Kwali, it was based on what we saw in the hospitals, the cases that were coming up. And then when you look, that's the importance of keeping your data and all that. When you look and you see that people that are coming in from this part of the community, and this peculiar problem is always coming with them. So we decided to just investigate it, and just a little investigation, and we found out that this was the problem. And so they don't have to lobby. It's just something that when the health week comes, we sit down, we discuss. As I said, 14 hospitals. Yeah. So everybody brings problems to the table, and we decide, okay, which is more pressing, which can we carry, because everyone has problems, or which one can we carry, and then we go ahead, look for support and see what we can do to bring it to success.
Thank you very much, Mr. President, and I wish you all the best. And I hope you and your guys in the association are carrying on well and getting well along with the Labour Ministry and the Health Ministry.
There are always struggles here and there, but we try our best to try to manage things. We know the situation of the country. Yeah. We know how things are difficult, but at the same time, just as you were talking about the oath, you have a responsibility to your patients, a responsibility to your teachers, and also a responsibility to yourself.
So thank you very much. It's been our pleasure having you here, and I hope when we call you again, you will oblige us. Definitely. Because we'll definitely call again.
Definitely. Thank you very much for having me. Thank you so much.
You're welcome. So thank you for watching our show for today. We've looked at the other side of ARD FCTA. If you have such communities where there are these difficulties and you do not trust those you can give something to go and help the communities, you can trust ARD FCTA. Tell them about the health challenges there. Tell them suggest to them what you want, or hear from them what they can do for that community. So the ARD always, every year, does something wonderful for a particular set of people, and it will just make a difference for those people. They will never forget that they were touched. Please, if you've enjoyed what you've watched today, don't forget to subscribe to our YouTube channel and hit the notification button so that you always get information when we post something. And then if you have questions or comments, put it down below. We'll get right back to you. Thank you very much for watching. Bye-bye.